right. Okay. So I'm audible to everyone, right? Everyone can hear me crystal clear. Hello?
Yes.
Okay. Okay. So talking about the OSCE, you can see my screen also, right? I'm writing, you
Yes.
can see it. Okay. Total, we have 17 stations divided into knowledge and skills. Knowledge is going to be 3 stations, which comprises of anatomy, critical care, and pathology. Okay, in anatomy, 3 stations, critical care, 3 stations, pathology, 2 stations. Fine. So major chunk is devoted into anatomy and critical care. 2 stations are of pathology. Yes, you have to give it importance, but your main focus should be on these first 2 subjects because they will be very scoring for you. Next comes the skills. For skills, you have clinical examination, then you have communication, you have history taking, and lastly you have procedural. Okay, clinical examinations, there are going to be 3 stations and rest of them 2 each. Communication 2, history taking 2, procedural 2. Now in these stations, these are the working stations. There are going to be rest stations as well. So there could be, like, the rest stations depends on the number of candidates that are giving the exam. So for example, considering communication station, just a second, let me accept someone who wants to join. Yeah. So considering communication, you will be given a station to prepare. So talking about communication, you will be having 2 stations. One is phone call and one is with the patient. Okay, so before you enter the actual examination station, you will have a previous station which will be also 10 minutes, and in that station you're going to prepare. How you're going to prepare? You'll be given a case report and you have to go through the case report. Now the only difference between the 2 stations is that in phone call you are going to be talking over phone with your senior or with some consultant, etc. And with the patient, there's going to be an actual examination station where there's going to be a patient and you're going to talk physically, and there's going to be a layman examiner and the actual examiner. I'll tell in detail in some time. So about this pattern, I hope it's clear that how it is divided. If people ask me about, okay, how much am I supposed to score, is it necessary to pass in both, or is it okay if I pass in one, or what? So you have to pass in both. How is the passing rate decided? It depends from center to center. It varies from center to center. It varies from the date of the exam. For example, let's go to the next page. For example, if the exam is in Delhi and dates are 1, 2, 3, 4, 4 days exam, so it's not going to be the same. The pass rate is going to vary because there are different candidates on different dates, right? So on this day, suppose the pass rate is something, knowledge is something 105 and skills is something 111 or anything. This is just an example. So on this second day, it's not going to be the same. It depends on the candidate performance. So we are not deciding the percentage level pass rate here. It's going to be percentile pass rate. It depends on your performance. All right. So it's important to know that you have to pass in both. So you cannot take one, like you cannot give one importance and take the other one for granted. There are people who score very good in knowledge because they study it very dedicatingly, and then they lose one mark in skills. Don't do that. Give both the parts equal importance because it's necessary to pass in both. The overall marks for knowledge is 160, and for skills overall marks is 180. Together they are 340. Pass rate, your target should be, it varies, right, but your target should be very high. So for knowledge, at least target at least 110 or something, and skills target 120, right? Target a minimum 65-70% for the exam. All right. Next, what can we talk about? Okay, we can talk about timings. How is your exam going to be? So the exam is going to be a circuit based exam. For example, you suppose you are a total of 20 candidates in the examination center. 10 are going to go for knowledge, attempting knowledge area. 10 will be going for skills. Sorry, 10 will be going for skills. So you'll be starting, for example, on my exam day, I started with clinical examination. So first clinical examination, then procedural, communication, and then I moved to knowledge. The history taking part was in knowledge section. So everything about knowledge, the anatomy, pathology, and critical care, everything came in that. In this circuit, everyone has a different rest station. The rest station is going to be the same time duration as your normal station. So your normal station is of 10 minutes. Every station that I spoke about is of 10 minutes. How is this 10-minute divided? 1 minute is for your STEM. You're going to read the question. Where are you going to read this question? You're going to read this question outside your examination hall. So you have a room, small cubicle, where your exam is going to take place. For example, your anatomy station is there in this cubicle. Outside the station, on the wall or somewhere, there'll be a paper stuck. On that paper is your question. So this 1 minute will be for you to read this question. Then once you go, talking about knowledge stations, okay, now. So rest of the 9 minutes is going to be your question and answer. So suppose anatomy is going to be full on this way, pathology is going to be full on this way, critical care is going to be full on this way. 1 minute for reading the STEM, 9 minutes for question and answering. Now you will say that how am I going to quickly move to the next station? You don't have to worry about that. After your 10 minutes, you will have 1 minute to move from one room to the other. They are going to give you 1 minute to relocate yourself. So you're going to, once you're moving from one station to another, you're basically going to have your back towards the wall so that you don't start reading the STEM. As soon as that 1 minute is over, there's going to be a bell. The bell is common for everyone. They're going to generally ring a bell. So once you hear the bell, you're going to turn, or maybe they'll announce that okay, now you may read the STEM. So you will turn and you will read the STEM for 1 minute. Then after that 1 minute, again one more bell. Then you're going to enter the room, the cubicle, and then there's going to be an examiner who's sitting there. He's going to ask you your candidate number. You're going to tell your candidate number, or maybe if there's a sticker, you're going to hand over the sticker, and you're going to have a seat, and the question answering will start. How it's going to go, I will come to that. Before that, let's consider the skills timing. So for skills, considering clinical examination station, 1 minute again for the STEM. 6 minutes is going to be to perform the skill, and then 3 minutes are going to be for question and answer. So whatever examinations or your steps that you're going to perform, it has to be in within these 6 minutes. The bell is going to ring. For example, in our station also, every time a timer was done, the bell rang. So after 6 minutes also the bell is going to ring, or the examiner is going to call you himself that okay, your time is up, now come to me for question answering. Alright, this is the same for clinical examination, this is the same for history taking. For procedural, however, it's going to be 1 minute for STEM and 9 minutes for the performance. I will tell you what you have to do in the performance. So 1 minute for the STEM, 9 minutes for the performance. What is left? Even communication. Communication also the same. 1 minute for the STEM and 9 minutes for the performance. Alright? This is the overall time. Now, what if you finish early? If you went for the knowledge station and you finished your station within say 6 minutes, you have 3 minutes remaining. Can you change your questions? Can you change your answers? No, you cannot change your answers. Once you gave an answer, that is final. Now, if you are unsure about some question, for example, they ask you a question in anatomy and maybe you are 50% sure, 50% unsure, you can politely always ask the examiner that please can I come back to this question, or please could you go to the next question, I would like to come back to this. Never say that I would skip this question, or I don't know, or don't spend a lot of time answering, because your basic task, your main task should be to finish the station as the time, as the marks for each question is not the same, not every question is given 1 mark. There could be some questions which are having longer answers and which may have 3 marks. And suppose if this question is towards the end of the station and you are not able to make it because you spent a lot of time thinking about a previous question that you not even were sure about, then you will not be able to come to the last question, right? And you will end up losing your 3 marks. So whichever questions you know, answer them quickly, and then if you are unsure about certain thing, politely request that I would like to come. And then after your station is finished, the examiner will himself tell you, or you can politely ask that can I please go back to my previous questions. Now if you finish before time, you're just going to sit with the examiner. You're not allowed to speak because the examiner has been told, has been instructed to not do any partiality. He should be quiet, he should be equal to all of them, and he should not be communicating with you in any form. All right, so that is, you should not feel awkward that, oh, the examiner is not talking to me, oh, the examiner is not giving me any reaction, he had a blank face, so maybe I did not answer well. No, the examiner is supposed to have a blank face, because if he shows any reaction, that means he's giving away the information, right, that how well did you do. He's supposed to have a blank face, he's supposed to be very neutral, and he's not supposed to communicate with you anything apart from the questions that he's supposed to ask. Okay, and they will all have a checklist for this exam. So everything, all the questions that they are going to ask is going to be from that checklist. They are not going to ask you any different questions specifically, because they are not allowed to. So it's going to be a very fair exam, you don't have to worry about it. Let's go to individual stations now. For example, starting with our knowledge, first station, anatomy. You have to know subjects like the basic systems: upper limb, lower limb, thorax, head and neck, the abdomen. These are the basic things. We did that in part A as well. It's going to be the same here. There could be pictures, rather I would say there are going to be pictures. So you have to identify a lot of pictures. The questions would be definitely related to those pictures. So make sure you see all the atlases. You don't have to go for multiple resources. Whatever resource you follow, stick to it and go through all the pictures, because anatomy never changes. Everything is going to be the same. The origin, insertion of a muscle is going to be the same. It's not going to be different in every book. Also there's going to be one examiner definitely who's going to ask you the question, and there could be one patient. In some centers, for example in Mumbai, there wasn't any patient, but in some centers there are. So if there is a patient, your main task is going to be to demonstrate some surface markings. For example, they can ask you to demonstrate the triangles of the neck, or the anatomical snuff box on the patient's hand, or maybe some movements. Maybe they would ask you that how would you check the knee reflex, ankle reflex, all these basic stuff. So when you see another second person in the station, don't worry, it's going to be very easy, normal thing they're going to ask you, that something that you know. It's not going to be anything out of the box. Some centers also have hybrid examinations. What is a hybrid examination? That there is not going to be a physical examiner present, it's going to be over the screen. So there could be a screen, a laptop or something, and it's going to be over some meeting, any platform, maybe Zoom, maybe Skype. You're going to enter the meeting and then he's going to ask you virtually. But the thing is going to be the same. There are going to be photos. They will ask you, okay, look at photo A, look at photo B, tell me what is this marking, tell me what is that marking. Okay, so what do you think about this? What do you think about the blood supply? What do you think about the nerve supply, etc., etc. All right, this is about anatomy. Again, if you don't know a certain question, you can always get back to it. It also depends from examiner to examiner. Some examiners do consider coming back to a question. If you are lucky, then yes, you will have a kind examiner. If your luck is not in your favor, then maybe you will have to answer it on the spot. So you have to see that how it is going to go for you. Till now, any questions regarding the marking system, the timings allotted, the anatomy station, anything?
No, it's very clear, Sanika.
All right. Next, let's move to another knowledge station, critical care. Okay, there are going to be 3 stations, like I told you. There would be some general topics There are going to be general topics. There are going to be some topics related to trauma, and there are going to be some identifications that you have to do. Basically, you have to decode some ECGs, or maybe X-rays, or maybe some arterial blood gases they are going to give you, and etc, etc. Maybe some analysis they are going to give you. They'll ask you to give a final diagnosis, what do you think it is. So the general topics related to lots of things, such as pain management, which painkillers are you going to consider and what, some electrolytes imbalances such as calcium, uh, potassium or sodium. And for trauma, basically we have to think about the ATLS protocol. The guidelines are available online. So ATLS protocol for some general conditions, we have to consider the care of critically ill surgical patient protocol, CRISP, that is CRISP. All of this, answering the critical care stations has a format. For example, for all the critically ill patients, you have to mention some statements that I would like to manage this patient according to care of critically ill surgical patient protocol, ABCDE approach. For trauma, I would like to manage according to the ATLS, Advanced Trauma Life Support Protocol. For ECG, you have to give direct answers. You don't have to go into detail. None of the knowledge stations require detail. The answers are going to be short, they are going to be crisp, they are going to be direct. There could also be one word answers. In all the notes that we see, there are explanations given in paragraphs, but that is not expected from you. The questions are not going to be exactly the same. They are going to rephrase certain questions, and you have to give direct answers. They'll ask you, what do you think it is? Then, okay, what will be your next step? So I will do this, I will contact this surgeon, I'm going to do this, I'm going to do that. Answer with the flow. Don't just memorize it for the sake of memorizing. Memorize with understanding. Okay. Here also the same logic you can apply, that if you don't know a certain question, you can skip to the next one, and once you are 100% sure, you can answer it. Next we'll go to pathology. So pathology, obviously not many people have touched their pathology books for a long time, so it kind of becomes boring to come back to this subject. But luckily we have two stations in it. And if we see every station that we have, for example anatomy, we have 3. So every station has 20, 20, 20. Critical care, we have all 20, 20, 20. So if you calculate all, 60 plus 60, 120, you will easily score 120. And I told you your target should be around 120, or maybe less. I told you less. So it's going to fetch you a lot of marks, and you can score very high marks in both of them because the questions are very direct. Pathology, sometimes people find it difficult to understand, but it's okay. I don't think it will take much of efforts. You just have to understand the basic idea behind it. You don't have to open the Robbins pathology textbook or any other big pathology textbook in order to answer the MRCS exam questions. So how to go about with it? There are going to be some general questions, and there are going to be some topics related to cancers. Maybe esophageal cancer, stomach cancer, gallbladder cancer, etc, etc. So general questions you have to sort of mug up because they don't change. For example, talking about the necrosis apoptosis processes, talking about some particular situations like Clostridium difficile infection, or what else can I say? The tissue diagnosis, what is cytology, histology, etc., etc. What is malignancy and cancers, as I told you, all those. So some things never change. So you have to understand the logic, and you can always rephrase your answer. You don't have to give bookish answers. They want to know from you that do you know the concept behind it, or are you aware of the idea. That's what the examiner is expecting from you. He's not expecting bookish word to word step by step knowledge from you, because the knowledge part you already gave for part A. You already did that step. This is about your professionalism. There are lots of marks for the knowledge in the knowledge stations also for the professionalism. For example, how will they test your professionalism, if you may ask? How are you entering in the station? How are you interacting with the examiner? How are you seated on your seat? How is your approach to the questions? Are you able to understand the question? These all things come under professionalism. So a lot of your marks are for professionalism too, and of course you should know the basic logic behind the station that has come to you. This is all about your knowledge part. We can go for the skills now. If anyone has any questions for knowledge, please don't be shy, you can ask. If not, then we'll move to the skills part.
I have a question, ma'am.
Yes.
Regarding, like, do we have any stations based on physiology, or is it all applied?
It's all applied. It's not going to be like, very in depth or something. It's going to be all applied, related to the patient. That suppose this has happened to the patient, what could be the cause behind it, etc., etc. For example, lidocaine toxicity, what happens in it, what was the
Mm.
reason that it happened, what could be the
Okay.
clinical significance, what is the clinical picture, etc., etc.
Okay.
Yes. Once you go through the questions, you will understand that it is not, something that you have to mug up. It's very much logical that, okay, so if the person has this thing, then these things could happen to him. If a person has rhabdomyolysis, what is rhabdomyolysis? What could be the risk factors? How would I manage such a patient? What am I supposed to monitor in such a patient? Etc. etc.
Okay.
Yes. Try to
Thank
apply this. Don't try to, consider this as a burden that, oh no, I have to
you.
read so much. Consider that you're going to think about all of the scenarios logically. That, okay, suppose I face such a patient in the future. What would my approach be towards such a patient? That's what they want from you.
Thank you.
Okay. Yes, someone is raising their hands. You can ask.
Ma'am, I have one question, ma'am.
Yes.
Uh, Ma'am, if suppose in between, if you don't know any question, can we say, can I skip this question like that, or what to do,
Don't
ma'am?
say,
If
can
I
I
do,
skip it? Because skip technically means that you don't want to come back to it, right? So just say that
okay,
I would like
so
to come back to this question, or can I come back to this question later, please?
okay, ma'am.
Okay?
So in this knowledge part, this 9 minutes, they will just ask questions and we have to just give answer. That's
Yes.
it.
Yes. It's only question answer. If there is a third patient, like a third person who's acting like a patient, maybe there is something that they want you to demonstrate. Maybe some surface marking, maybe some action. For example, maybe what do you call ritualistic sign in hypocalcemia, the spasms that you do after tapping the facial nerve, etc., etc. So something like that sort, but it's not going to
So
be
the
something out of the box.
so they will do in knowledge part also, right?
They could do. It doesn't happen in
Oh,
every station, every center, I
okay,
mean. They could do that.
okay,
It
ma'am.
could be expected from you to demonstrate on a patient, because see, this also tests your professionalism, right? Because how are you going
Yes,
to
ma'am.
demonstrate it on the patient? Like, you're going to take consent from the patient that I am asked to demonstrate this. Is that okay with you? Then okay, and you're going to say that, could you please do this for me, could you please do that for me? All right.
Okay, ma'am.
Yes, but 90% it's going to be just a question answer thing.
Okay, okay. So basically, everybody used to tell pathologies will be very tough rather than anatomy and critical care.
It is basically not tough. They find it tough because, first of all, it's a subject that no one wants to go back to, and second of all,
Mhm.
they find some questions to be very new. Now, obviously, in every exam, there are going to be some new questions, right? Because if
Okay,
everyone knew all the questions, there would be like full mark scorers everywhere. They have to maintain the standard of the exam. So there are going to be new questions, and we should take it with a pinch of salt. It's okay, because
oh,
if it's a new question for you, that means it's a new question for everyone.
yes, ma'am.
Yeah, so don't worry about which station is going to be difficult, or this is easy, or there are going to be new questions. No, if it's a new question for you, it's a new question for everyone. So keep that in mind. And second of all, have a neutral mindset to all the stations, that okay, I have studied for all the stations, I have given my best, and now I will see that how I'm able to perform.
Okay, ma'am.
All right. So, coming back to communication, as I said, there's going to be two stations for communication, one with the person and one over phone call. For before every station you will have 10 minutes to uh, like have your time with the case report. You're going to have a case report. There's just going to be a cubicle. You're going to enter. It's going to be just you, case report, bottle of water, pen, pencil, and a paper. So you have your case report. You're going to read what the scenario is. There's going to be a stem. You're going to read what the scenario is. You're going to understand what have been the changes in this patient, the blood tests, maybe some ECG reports and stuff. You have to read everything in 10 minutes. For phone call, it is better to make notes in these 10 minutes, because you have to talk to the senior consultant and they are going to ask you certain things, that okay, so what is their this level, what is their calcium level, what is their potassium level, what did you see in the ECG, what are the findings, then what do you think the cause is, why do you think this is happening to the patient, etc., etc. So they'll ask you. So you should be thorough with your patient, because you are actually giving a summary to the consultant. So if you don't know something, that's going to give you negative points in that like you are not aware, and why are you wasting the consultant's time. In in a particular scenario where you read everything, but there was a certain point that you missed and the examiner asked you that, and the examiner got angry and he disconnected the call, no problem. You have your case report in your station 2. You can just quickly go through it, find what the answer is, whatever the examiner has asked you, call back, apologize that sorry, I went through the case report again and I found this. So the patient has this. Okay, never get discouraged that oh, the phone, like he disconnected, that means my station is done and now there's nothing that I can do. I mean, I failed this station. No, it happens in real life also. We call our consultants, sometimes we're not sure about something and they disconnect, but we always call back, right? So we are going to call back. We are going to correct ourselves that okay, yes, sorry, I apologize that I had not gone through this information, but yes, I read it now and this is the answer. So this is for phone call. You're just going to have a direct conversation. They are going to ask you something related to your patient. In person, you're also going to have a case report. You can note the main points, like you can note the patient's name, age, what was the purpose of them getting admitted, some important points, and then you're going to go and have a chat with the patient. So you're going to let the patient talk. Once you're entering the station, there's going to be not only the patient, there's also going to be one main examiner, there's going to be one layman examiner who is going to check your communication skills. For example, when you're talking to a patient, you don't use medical terms, right? You will not use complex terms, because the patient is not supposed to understand such complex terms. He is not a doctor. So the layman examiner is going to assess you on your communication skills, that how easy are you making it for the patient, how are you communicating, how is your approach towards the patient, and the examiner is going to test you for your skills in communication. That's it. So there are three people who are going to be in this. How is your approach for communication station? You are going to let the patient talk. Now you're going to let the patient talk. You're going to obviously introduce yourself, ask the patient's name and age, etc., and then ask for the patient's concerns, that what do you know so far, how can I help you, I'm here to assist you. So lots of empathy is required here. Lots of empathy. You're going to let the patient lead you, right? And you're not going to just blindly stick to the notes. What many people do is they follow a certain script that is given to them and they answer just like that, like the patient is asking you something else, but you're following a certain script and you're answering something else. So don't do that. The way I am talking to you right now, with a flow, without any script, talk in the same way. Discuss with the patient whatever he is expecting from you, whatever he is worried about, whatever his concerns are. Answer only those things. They are not going to give you 100 marks if you keep talking, if you keep talking to demonstrate your communication skills. No, it is all about your approach. How are you letting the patient talk, and how are you responding to the patient's questions? That is at the communication station. Okay, if any questions in communication?
Yes, I have a question.
Yeah, go ahead.
Let's say I'm on a phone call with one of the consultants, and he asked me about the ECG graph,
Okay.
something I have zero knowledge about.
Okay.
Mm,
Then
can I bluff? Can I bluff to him,
you
or should I?
You can politely say that, can I get back to it? Or if you are still not
Okay.
able to decode it, then you will say
Mm-hmm.
that I will consult with one of my seniors in the
Mm-hmm.
department and I will let you know
Okay.
what I find here.
Okay.
Okay?
Okay.
Just
Okay. Yeah.
keep it as natural as possible, because in the real life scenario also we would have done that, right? We would have taken
Mm-hmm.
advice from some other person who knows how to diagnose ECGs.
Okay.
Yes. Okay. So let's.
Ma'am,
Yes, yes.
uh, in phone call, like case report, they will give now. Like what basically what can we expect from, like only ECGs like that, or
It depends from station to station. So not every station is going to have an ECG. If they have it, that means you have to see what that ECG is about, because most probably they'll ask you something on that ECG.
okay,
Yes, but the ECG could be maybe atrial fibrillation or hyperkalemia, tall tented waves, T waves, or something like that. Something that you already know, something that you will already study for your critical care.
so like what they will ask, ma'am, like in phone call, what they will ask about
They
this?
will ask you maybe that, okay, so have you taken an ECG? So if there is, then you'll say yes, yes, there is an ECG. It was taken on this date. Then they'll be asking you that, okay, so what do you see in it? Does it tell you? You'll say that I see this. It's a regular ECG, irregular ECG. What are the findings that you see? You'll say that. If there's something that you don't understand, you'll say that I will kindly allow me to consult with one of my seniors to know the accurate diagnosis of this
Okay,
ECG.
ma'am.
Yeah.
Okay, okay, okay.
As you go about with studying these stations, you will come to know that what are the expected questions for this. They'll not
Yes,
ask
ma'am.
you very much in depth. If they ask you, just always use a natural approach. Never lie in communication stations. When there is some information that is not given to you, don't make it up. For example, if a patient is asking you about certain dates, that when is my procedure going to be, and if you don't know, don't give them false hopes that, oh yeah, it is going to be tomorrow, so you come today, get admitted today, like you would in your normal practice. Because in normal practice, you know that when is the patient
Yes,
supposed to
ma'am.
be admitted, what is the protocol, you know it. But here you don't know. So here politely always say that I will consult with my senior consultant, I will ask him for an advice, I will ask him about your situation, and I'll get back to you, don't worry. Okay, never lie to
Okay.
the patient. He'll be like, oh doctor, is it this, is it that, do you think I'm going to die, this, that. No, don't say that, oh yes, it is a very serious condition, oh yes, it is that, it is that. No, if it is mentioned something that is serious, you say yes. If you don't know about something, you say I will consult with my seniors and I will get back to you.
Okay.
Yes. Okay. So clinical examination, 3 stations are going to be there. The timings, as I told you, 1 minute for STEM reading, 6 minutes for the performance, 3 minutes for question and answering. Clinical examination is going to test you on various subtopics. It could be something related to systemic problems, maybe some cardiovascular, respiratory problem, or abdominal problem, something related to maybe lumps, maybe something related to orthopedic stations, maybe something related to the central nervous system or cerebellar station, etc. There's a variety. So what, how is your approach going to be to this? You are supposed to first read through all the stations, yes, and then you're supposed to divide them, that okay, so this station, these type of stations, for example systemic examination stations, have this approach. You have to create bullet points for yourself. The lump station has these approach. This is my approach for the exam. Ortho stations, these are the steps that I'm supposed to do. Okay, for the clinical exam, all the stations require practice, yes, but clinical exam will require physical practice, because you have to show to the examiner, you have to act in front of the examiner. So if for in order to act, you cannot just wake up one day before your exam and then go directly for your exam. No, you have to keep practicing, because you have to demonstrate certain techniques, you have to have a proper introduction, you have to have a good approach to the patient. And all of this doesn't come instantly, it comes with practice. Initially there will be lots of days where you'll feel like, oh, this person is performing better than me, and I am not able to do it so much fluently. It doesn't matter, practice multiple times. Some people get the approach in 2-3 practices. Some people take 10 practices. It's okay, everyone has their own way of learning. So discover your way and go accordingly. It's better to have a study partner in this, because there will be someone to assist you with it. There'll be someone who will see how you're performing, and someone who will call you on it, that array, but you forgot doing this, you forgot doing that, you have to work on your this skills, that skills. So there'll be someone to tell you, but it has to be someone who's also giving this exam, because they'll be knowing the pattern. Of course you can practice on your relatives, friends, colleagues, but they'll not be able to give you a good feedback for your exam purpose. So have someone as a study partner. It doesn't have to be your friend whom you know for a long time. It can be some random person also. Just one day you message anywhere on the group that is there someone who wants to practice, my exam is on this date, and practice with them. In this way you will improve your confidence, because you are discussing with a stranger, and on the exam day also you are going to be surrounded by strangers, so you have to build up that confidence. In clinical examination also, very important, professionalism, empathy. It's always very important. Always ask for pain. Always say sorry if they are having pain. Sorry that I have hurt you. Do you want me to stop? For professionalism, if you're exposing that I would like to expose this part, will you be needing a chaperone? And after the exam, always cover up the patient, maintain the patient's dignity, etc., etc. Now some people ask that I am not a surgeon, I am an intern, so what do I do? Should I even give this exam? I have just finished my MBBS and I don't know anything about surgery. How will I perform in clinical examination? It's okay. The exam is a very standard exam. It has a certain set of rules that you have to follow, which is doable by everyone. There is just a minimum criteria. They are going to assess you on communication, professionalism. There are some basic points that they want to see, that if you're doing or no. They have a checklist. So whenever you're performing something, they're going to just give you tick mark that yeah, he performed this, he introduced himself, he washed his hands, he did this, he did that. It's going to be like that. So it's all about the approach. They're going to test you on your approach. They're not going to go ask you to cut a patient open and ask you to demonstrate something in surgery. No, it's not that. It's a very doable exam for all the MBBS graduates too. So this is the clinical examination station. Moving to history taking. The timing is the same. 1 minute for STEM, 6 minutes for performing, 3 minutes for question and answer. There are total of 2 stations in this. Now, who is going to be in this station? There's going to be the examiner. There's going to be layman examiner, because obviously in history taking you're going to communicate with the patient. So the layman examiner is going to keep a watch that are you using any medical terms, what are you doing, how are you communicating with the patient, how fluent you are, how is your approach, etc., etc. And of course there's going to be a patient with whom you're going to talk. The examiner and layman examiner are not going to bother you. The examiner will ask you questions in the last 3 minutes. Before that he is not going to bother you, and you are also not supposed to directly have a contact with the examiner. Now with the patient, there is going to be a certain approach. You'll learn about it as you start studying, but then there is a format for history taking that you all must follow. There's going to be an introduction initially, then there are going to be main questions related to the diagnosis. For example, if there is any bleeding happening in the patient's stools, there is blood, so you're going to hover around the questions related to that. You're going to ask a few questions related to the differential diagnosis, and then you're going to ask the basic questions that you usually ask: the personal history, social history, family history, the ICE questions, ideas, concerns, expectation, etc. The format is going to be the same, it never changes. In order to memorize this format, again practice over and over again, because the questions are definitely different, but then you will be able to remember them only after practice. Don't think that okay, I read this station once, I know the questions that are supposed to come and I will just go and perform. It is not going to happen that way. You might get confused on the day of exam because of the stress or because of the unusual environment that is there, because such exams usually don't happen, we don't give it every now and then. So have thorough practice. Just pick up random stations who have exam like in a month or so. Pick up random stations, notice the main questions that you're supposed to ask, have a basic idea of how you're going to approach and then go for it. This is all about history taking. You're going to have a pen and paper in this station. So you're allowed to write down notes, but obviously you're going to take consent from the patient that I'm going to make a few notes. Is that okay with you? So you're going to take consent for everything that you do, because at the end you're taking information from the patient, right? So you will have a pen and paper, but the main thing over here is again your approach. So you should not be into your paper, into your sheet. You should have a good eye contact. You should lean forward a bit, look at the patient, smile, address to all their concerns. If they say they are having some problems, say, I'm so sorry that you're going through this. I can only imagine that you are going through this, etc., etc. Have a professional approach towards the patient.
Yes, I have a question. May I ask?
Yes, yes, please.
Thing is that like this consent, will it be like a documented consent or just
No,
simply
verbal consent.
verbal consent?
Yes.
And regarding if without the presence of a chaperone, are we allowed to proceed
You're
for examination, or like do we need to have a chaperone for all cases?
So there are going to be some stations that are sensitive, has sensitive questions. So in that case,
Mhm.
you will always ask the patient that will you be needing a chaperone, or if you think that chaperone is definitely needed for the station, you are going to directly look at the examiner and say that I will be needing a chaperone for the station. So the examiner will
Okay.
be like, okay, so I'll act like a chaperone. You may
Mhm.
proceed. Yes,
Okay. Yeah.
because
May
we
I know
have
what is
to.
saffron?
Chaperone is a third person who is there to monitor what's going on, because you're going to ask sensitive questions towards the patient, right?
Okay.
Yes.
Chaperone is basically an attendant, the proper term for the.
Yes,
Okay.
an
Okay.
attendant.
Okay. Got it. Thank you.
Yes. So you have to keep in mind that the circuit is not going to stop. One station ends, you move to another, then another ends, you move to another. So if you're asking for a chaperone, you don't have to wait for someone else to come and stand, because you don't have enough time to wait for things to happen, right? So that's why just verbally ask. Everything is going to be verbal. Every documentation, everything is going to be verbal, so that you finish everything in the particular time frame. Okay. So procedure, the last skill station, I think. Again, timing over here is going to be 1 minute for the stem and 9 minutes to perform. So in this 9 minutes, when you're performing, while you're performing, the examiner could ask you questions in the middle. So you have to perform as well as answer to the examiner's questions. When you're performing, an examiner asks you something, you're just going to look at the examiner, answer, and then continue again with your station. There could be questions that the patient asks, that, oh doctor, so can I do this, can I do that, will I require this, will I require that. You're going to answer the questions as you're doing the procedure. Make it like a normal procedure, like you would do in real life. Don't make it awkward that, okay, you are very much engrossed in just finishing the station and you're not talking to the patient at all. No, here also your communication is somehow assessed. So even though there's going to be an examiner here and it's going to be you, there also would be an assistant here for you. So not every exam, like procedural station, has an assistant. There could be, there would not be, it depends. So if there is an assistant, always ask for an assistant, that okay, I will need an assistant for the station. If there is not, then the examiner himself will act like an assistant for you. Why is assistant important? Because you are going to be sterile, you cannot open the packets by yourself, you need someone else to open it for you. So there is always a need for an assistant, so ask for it. When you enter the station, own the station, it is your station, you are going to do the procedure, so whatever you need, you ask on the spot. So in procedural, again, you enter the station, the introduction, the performing part, and question and answers that the examiner will ask you, patient will ask you, and at the end, professionalism and empathy, etc., etc. People ask, do I need surgical experience for this? I have not done any procedures, etc., etc. The procedures are very basic. You should know the basic surgical skills, like knot tying or stitching, simple sutures, this, that. You should just know the basics. They are not going to expect anything high level from you, because you are a core trainee level over here. You are not a specialist. So it's very doable for MBBS graduates as well. So I think I'm done with explaining the stations. What we could discuss further is how to study. Like what materials should I use? There are lots of them online, all the PDFs, etc. It's all there. It's all the same. There could be 1-2 questions that are different, but do not mix it. Do not go for all the resources. Fix one. Make one notes your main notes, and the others could be additions. If you find a new question, okay, but don't go about finding new questions. There are going to be lots of questions because there are lots of books for MRCS. Just a second, someone wants to join. Yeah, so there are lots of books for MRCS, and you cannot read all the books in the span of 3 months, right? Every book, it has 300, 400, some have 1000 pages. You cannot read all of them. So follow certain notes and stick to them. If there are some extra things that you find, note it down. That should be enough. Have one mentor, don't have multiple mentors, because everyone has their own opinion about how they have appeared for the exam, about how much they know. So follow one person, you will still pass. At the end, it's all about passing this exam, because the marks don't matter as much. You have to clear both the stations. So stick to one notes. It's going to have 70 or 80% of the things. Other things you're going to gain by your own professionalism skills, empathetic skills, and your own previous knowledge. Don't go about looking for questions that, oh, what was like in this exam, what was asked, could you please tell me, could you please tell me. No, you don't have to go for all of that. 100% questions are not going to be the same. Anatomy pictures are not going to be the same. Anatomy doesn't change, so just know the basic structure that is there, and a similar pattern will be asked in the exam. So don't go about mugging up all the things that you get in your way. It is a very structured exam. Don't overdo it and mess it up. And don't keep on delaying, because you will never be 100% ready for a particular exam. You give your best, study for your time frame that you had, and go and give it. It will be, you will either pass or you will gain experience. Take it this way. Is it doable by all the candidates? Some people are able to do it, and some people have to give it one more time. It's okay. It's one of our medical exams. Take it that way. People ask, what is the prep time? How much time should I dedicate? So if you're going to give your all for this exam, like you have, for example, 6 to 8 hours every day, then you can do it in 3 to 4 months. But if you are very busy with your work, you work all day, and then you have your personal commitments as well, so you barely get 2 to 3 hours every day, then you should consider for 5 to 6 months. Remember, don't rush for the exam. Take your time, because everyone wants to do it in the first go, right? And for the first go, you have to give it so much time, and you have to be consistent, very consistent. Okay? For the preparation, have someone with whom you are going to study. Let someone be accountable, or you are accountable to someone, and study whatever is there. Don't go about asking people and getting discouraged. Whatever is there is there. Everyone follows the same thing, even though they might say that I also did this, I also did that. Alright. About other sources, there are many websites also that if you want you can follow. It is very optional, because at the end, remember, you just have 3 to 4 months. You cannot do everything. Places like EMRCS or Pass the MRCS or MRCS Part B questions, etc., etc., the doctor exam books, the other critical care books by Kanani or someone. So remember that the pattern keeps on changing, and at the end, it's not only about the questions that are there, it's all about the approach as well, like I said. So remember this, like, remember all of this, and make your own routine, have your own pattern, because not everyone studies in the same way, not everyone uses the same resources. So know how much is your capacity, know how much you can do, and go accordingly. For exam cost, it is something around 1097 pounds. That's the cost of the exam. And Apart from that, if you're giving in your own country, then fine, you don't have to spend as much. But if you are going to go to some other country, you have to consider the cost of the visa, the travel expenses, the accommodation, etc., etc. All right, so these expenses add up. What else can I say? If you have any questions, you may ask.
Yes, ma'am. I have a question.
Hmm.
Like I was wondering, like I've collected most of the books in their PDF versions.
Hmm.
I was wondering if I need to get a book in its actual physical form,
Hmm.
or just the PDFs will do,
How are
because
you
the PDFs
comfortable?
will. Yes, I didn't get you, ma'am.
How are you comfortable? Like, are you comfortable highlighting on papers, or are you okay studying over your iPad or phone?
I am more comfortable with physical book actually.
Yes, so just print it.
Mm, okay.
Yeah, that'll be the best. Because some people are used to books. I myself printed out certain stuff that I found important. So I could highlight, I could scribble, I could add stuff at the same, like in the same page. Yes. Okay. But everyone, don't go
Hello.
for multiple resources. Yes. Yes, go ahead.
Hello. Hi, everyone. I just passed part A,
Mm-hmm.
and
Congratulations.
I want thank you. And I want to ask in part B, like in part A, most of recalls come in paper one,
Hmm.
and paper two, a higher percentage are new questions.
Hmm.
What about part B? Is there do recalls concentrate in anatomy, pathology, critical care, or is sporadic?
It's for
You get
both.
me?
It's for both. The knowledge and skills both.
Okay, but which part people mainly fail at?
Uh,
We have to pay attention more.
it is actually, it varies because some people find difficulties in memorizing stuff. They are very good with skills, and they find mugging up very difficult. So they lose by a few marks in the knowledge stations. And some people in knowledge, they are very scared of the anatomy pictures, and they, because of the exam stress, they mess some things up. So it really depends from person to person. There are some people who are very confident in knowledge, but they end up losing 1 mark, 2 marks in skills because of some points that they miss. So it varies. It's not like
So
one part is difficult. All the stations are very standardized.
okay. Is there a supplement book we need? Like you mentioned that Kinani, you need extra months to read, for example.
Yeah.
Do we need a specific supplement? Because someone told me yesterday
Hmm.
that he studied the doctor exam book
Hmm.
and nothing came from it.
Exactly, because lots of books become outdated as time goes ahead, right? So you don't need a lot of books, lot of supplements. You don't need it. Just follow the PDFs that are there. If you are following a certain course, only follow that. You don't need to go for anything extra.
Okay, thank you.
Welcome. Otherwise, if you are confused, if you are reading certain PDFs and if you're confused about the concepts, you can always open up Teach Me Anatomy website or Anatomy Zone or over YouTube or Ackland's videos. You can find Geeky Medic videos. They do the like skills part, clinical examination part. They demonstrate. So the Geeky Medics videos, they're not going to be 100% same like you're supposed to do. No, there could be a certain extra things, but you just see how they are doing it, what is their approach, how they are doing the examination. Notice all of that. You can always YouTube
Sorry,
search. Yeah.
sorry. One extra question: do they, when you bring a new question, do they change like a new topic or the same topic but asking about something new?
So, when you're giving your exam in London, there could be new stations that could come up. There is a chance of new stations coming up altogether. But if you're giving in international centers such as Cairo or India or Kuala Lumpur, so the new stations come later, like after it has already come in London. That's when it comes to the international centers. It's not going to be first time in the international centers. Got it? So it starts from
O-
London.
Okay,
Yeah.
Okay, okay. Thank you.
Welcome. Okay. I told you about the materials. I think that's it. On the day of exam, if you want to know, I can tell you what to do on the day of exam. Does anyone want to know about it now?
You mean as a revision?
No, no, no. Like, how is the exam day going to be for you? Okay, let me tell you. Let
Yes,
me
ma'am.
elaborate on what it is. So,
Yes,
suppose you
yes, ma'am.
have
Yes, ma'am.
your exam today. So you'll be given a timing. Suppose your exam is at 11 o'clock in the morning. You have to reach at least 2 hours before that. They'll tell you that please arrive at this time. So arrive beforehand. Maybe arrive an hour early so that you get your time. You get some time to relax. So arrive early, and you'll have to carry your passport with you, and at least the email of the letter that they have provided, that yes, this candidate has this exam today. So you can either take a printout of it, or else you can just show them on the phone. But your passport is very important. Carry your passport with you because they are going to check your name, etc. etc. Now, once you're over there, once the timing starts, they are going to register you that yes, this candidate is present, and they are going to give you a general idea about how the exam is going to be. Just like the way I told you that there is going to be two circuits, half the people are going to go for knowledge exams, half the people for skills, and then they are going to switch. So they'll just give you an idea about what they are going to do. They can provide you with some refreshments. There are going to be some snacks. It depends on your timing, if you're going like for lunch or for an evening snack, whatever. So they'll give you some snacks. There will always be water. There are restroom facilities because the examination centers are usually good hotels where they conduct in big halls and stuff. So there would be restrooms. You don't have to worry about that. How are you supposed to be dressed up in the exam on the exam day? You're supposed to wear formals, basically something that is, your sleeves should be above your elbow level. You should not cover your entire hands. So your hand sleeves should be above elbow. Your feet should be covered. You should wear shoes that cover your feet. For girls, you can also wear formals like shirt and pants, or you can wear your kurtis. You can wear something, whatever you're comfortable with. It doesn't have to be, it just shouldn't be very gaudy, very shiny. It should be simple, it should look formal and decent. Okay. If you're traveling from somewhere and if you have a backpack, don't worry, they will have some facilities to store your backpack. You're not allowed to carry anything apart from a stethoscope, and plus you can carry a pen just in case if you want to, but nothing else. No paper, no iPads or digital watches, nothing allowed. I think that's it. And then you're going to enter, you're going to do your knowledge circuit, you're going to have some break where you can drink coffee, where you can maybe drink water, go to the restroom, and then you're going to switch. You're going to start with skills, and then you're done. After you're done, you're going to have a feedback session in which the examiner is going to ask you that how did the exam go for you? Were there any problems that you faced? Do you want to add something? Do you want to give a feedback, etc., etc.? So that's it. Any questions?
So yes. Sorry, I joined late. I didn't know there is a
Mama,
meeting.
please darwaza band karo.
So my question, you may answer it before. You said we need 6 months to prepare, for example. What about revision or
Revision.
revision? You need do we need to finish the material in 4 months and do 2 months revision, or what?
You should at least try to read a total of 3 to 4 times. It depends from person to person. Some people have a very photogenic memory, so they are able to retain information well. Some people have to do revision like 4 to 5 times as well. So the revision part, like your final revision, can be done in the last 20 days as well. But your first study like time, 2 to 3 readings, should be in the first 3 months, and last 20 days you can just read through material for your revision. Got it?
Okay. Okay, thanks.
Yes. Okay, guys. If there are no more questions, then that's it. All the best.
Thank you.
Welcome. All the best for your part B.
Yeah,
Do
yeah,
well.
thank you. Yeah, thanks.
Thank you, Ron. Thank you.